We'll be discussing the results of our phase 2 study investigating the combination of rituximab with pembrolizumab in relapsed follicular lymphoma. We have a sample size of about 30 patients. It is a single-center phase 2 open-label study, but we explored this combination with the expectation that the combination would be synergistic in regards to activating both the innate and adaptive immune response. We took patients that were rituximab sensitive, meaning they had achieved at least a partial or complete response to their last rituximab-containing therapy that lasted for at least 6 months. Of our patient population, the median prior lines of therapy was 1. So when we looked a little bit deeper into those prior therapies, the vast majority, approximately 75%, had had rituximab in combination with chemotherapy. Also, we found about 11 out of the 30 patients had actually had an early relapse, so a progression event within 24 months of that frontline rituximab in combination with chemotherapy, suggesting that even though this is a low median prior line of therapy study population, they were a higher risk patient population. We also note that at least half of them had met at least one of the GELF criteria, and all were felt to be in need of therapy. Our dosing schema is a little bit interesting in that patients get 4 weekly doses of rituximab dosed at 375 milligrams per meter squared, and then they receive 200 milligrams of pembrolizumab starting on day 2 and continued every 3 weeks for a total of 16 doses. In regards to dosing schemas with checkpoint inhibitors, I think that is still an unanswered question, particularly in lymphoma. But most of the Hodgkin lymphoma studies, they're continuing checkpoint inhibitors for a duration of 2 years. So this is a relatively short duration of therapy in follicular lymphoma. We don't consider there to be a maintenance approach in this study schema. The primary endpoint for our trial was overall response rate. We were projecting a response rate of at least 60% to be meaningful, particularly in comparison to historical controls with rituximab monotherapy. We observed an overall response rate of 67% from our intention to treat analysis. But what is most striking is that we saw a complete response rate of 50%. We have approximately 14 months of median follow-up, and currently the median PFS is a little over 11 months. The median duration of response, these are secondary endpoints, is a little over 14 months. We've observed no deaths to date. In regards to the safety, similar to what's been previously reported, the pembrolizumab in combination with rituximab was well tolerated with mostly grade 1 toxicities. We had infrequent grade 2 or higher adverse events. What's notable are the immune-mediated or immune-related adverse events that led to discontinuation of therapy in 6 patients. Noteworthy is all 6 had achieved a complete response, but we felt that the grade 2, and we had 1 patient with grade 3 elevated liver enzymes, was noteworthy in terms of stopping therapy early. We do not at this time, given this is such a small sample size, know if toxicity correlates with efficacy, but it is, even though our incidence of grade 3 or higher adverse events was quite low, we did discontinue therapy for recurrent grade 2 immune-mediated adverse events. At this time, we find that this combination appears to be favorable in regards to response rate, particularly a CR rate of 50%, and the side effect profile is quite manageable. So we think that this warrants further investigation in follicular lymphoma. At this time, we plan to expand this to a refractory patient population to investigate the efficacy in that specific setting. There will be questions as to how much this contributes to the rituximab, meaning is there truly synergism here? So a randomized study would probably be the preferred way to answer that question. However, we do find our results to be quite intriguing because single agent activity with checkpoint inhibitors in the relapsed follicular lymphoma in early phase studies are not quite as promising as what we've observed thus far.